When a child is referred to ADIS, the parents or carers are invited to attend an appointment in the Oaks to complete a developmental history. This parent interview is complete with an autism intervention therapist and can take up to 2 hours. The therapist will explain the assessment process and gain consent to complete a school or home observation and to liaise with any other professionals currently working with the child. The interview asks specific questions about the child's early development and the child's current presentation. This information is used to determine if the history and current presentation supports a diagnosis of ASD. The interview focuses particular attention to the areas of social communication, social interaction, play, imagination, and repetitive interest both now and in the past. As ASD is primarily a social impairment, observations of a child's functioning in a social setting with the same age peers can provide vital information. By carefully and attentively listening to and observing the child in their school environment, therapists can assess social strengths and/or difficulties within a social environment familiar to the child. This informal assessment enables observation of the child's skills within the areas of social communication, social interaction, and imagination and flexibility of thought, which are core to the diagnosis of ASD. As ASD is a social interaction and communication disorder, it is important that we gather updated information on your child's speech, language, and communication skills. If your child is not already attending with a speech and language therapist, you will be asked to see a speech and language therapist in the autism team. During this appointment, they may assess your child's understanding and use of language. They will also be paying attention to your child's conversation, interaction, and play skills. This information is then shared with the multidisciplinary autism assessment team. Once we have gathered all of the information, a multidisciplinary team will meet to apply the findings to the DSM-5 diagnostic criteria. This will ascertain whether your child meets the criteria for ASD, and if we feel that we don't have enough evidence to make a decision, we will invite for your child to attend for an ADOS assessment. ADOS is a standardised assessment which involves your child engaging with a therapist to complete a set of standardised activities. This assessment is then scored and gives us further indication as to whether your child meets the criteria for a diagnosis of ASD. All of the information is compiled together, and when the clinical team complete their assessment, you will be advised of one of 3 outcomes. Your child meets the criteria and a diagnosis is confirmed, your child does not meet the criteria and a diagnosis is excluded, or the outcome is inconclusive, and we will collaboratively agree with parents a period of ongoing assessment.